Assessment has always been a favorite part of my work as a counselor because it lays the foundation for treatment. So this week's readings got me more excited and eager to learn more about family assessment. Author of this week's readings, Silverstein, Williams, and others punctuate the importance of assessment to therapy as the success of treatment is built upon a solid and accurate assessment. Appropriate theory and its treatment course ideally emerge from the data, and the best theory to use can depend on several different factors, including presenting issues, underlying causes, client characteristics, and the fit between the therapist and the client's theories of change. Therefore, in my future work as a therapist, it is important to view clients from different theoretical perspectives and then choosing the best that fits the case. A beginning couple and family therapist like myself who has worked as a counseling psychologist sometimes emphasizes the individual factors if only an individual presents for therapy, eliminating relational context that may shape the client's thoughts, feelings, and behaviors. I must acknowledge that systemic principles can be used to understand an individual, and as a systemic therapist, I must recognize that our clients often find themselves caught in relational patterns that create problems for them. Even in cases where individuals are labeled as having an individual problem, considering relational context is still important. For example, an individual with alcohol use disorder with supportive family members can be a protective factor. Conversely, families can influence the course of an illness. Individuals with schizophrenia are more likely to relapse if they have hostile and unsupportive families. It goes without saying that when it comes to treating couples and families, I must explore the presenting complaint while at the same time challenging the family's certainty that the problem lies exclusively on the identified patient. I must broaden the focus from the identified patient to relational patterns, exploring how family members may contribute or perpetuate the presenting problems. For example, equal power helps couples create intimacy and relationship success. However, though couples increasingly desire equal relationships, that is not the case. Silverstein and his partners remind us that many problems and symptoms may be related to relational orientation, and clinicians often approach heterosexual couple therapy as though partners are inherently equal, thus reinforcing unacknowledged gender inequities. Power imbalances between partners are intrinsic to relationship distress and intricately connected to emotional experience, to the couple's communication processes, and cultural context such as gender. Working with the power dynamics between partners is thus critical to therapy. It is essential to have clear frameworks that focus on how people engage relationally. For example, the relational orientation framework helps clients become relationally attuned, navigate into more satisfying relationships, and address issues such as depression and addictions, for example, from a relational perspective. This framework also allows therapists to identify and address power disparities and introduce alternative relational experiences for couples. I have observed two typologies of relational orientation presented by Silverstein and partners in my own family of origin and my relationship. First, as a Filipino from a patriarchal and collectivistic culture, my late father's relational orientation was rule-directed because he had the power and authority. He was responsible and accountable for making decisions for the family and used this for the family's good. My mother's relational orientation, however, was independence-oriented. This conflicted with my father's, and like most rule-directed relationships, problems between my parents emerged when he abused this authority. An appreciation of this insight and my attempts to minimize power differences made me consciously choose an egalitarian relationship. And as one may guess, my husband and I exemplify relationship-directed orientations, making our relationship a high priority. Our relationship needs are not separate from personal needs, which enable us to respond to each other or our relationship. And harmony is chosen over conflict. And because harmony is chosen over conflict, problems may emerge when conflict is avoided, as it limits authentic personal expression. One of us may carry more of the burdens for relationship maintenance, as for example, when I leave the decision making to my husband, as I often remain open to him. Therapists can teach clients to map the different types of relational orientation among their relationships and assist in creating goals, identifying sources of problems, reducing blame, and creating a shared vision on which to work toward. And for those that desire a change in relational orientation, this provides a framework for making sense of the shift as they struggle with issues in their relationships.